Wanna go to the Wet Body Talk program where they come to you live from Radio Maria Salon with me, Gifty Masakoi. Remember, say this program they come live to you every Sunday 4 to 5 something with Master Sabi people them from the Wet Body workplace. Inside today young program, I get a physiotherapist ready with me for can talk about the 2025 World Physiotherapy Day, where the theme for this year's celebration na healthy aging. So we go start this program now in the name of the Father and of the Son and of the Holy Spirit. Amen. Papa God, we want to tell you thank you for the gift of life. We'll tell you thank you for celebrating the exaltation of the cross. We'll continue for pray that everybody gets your individual cross, that you will give it the strength and grace for bear whatever challenge they go to, and let we always see you face. Commit this program now you are now in the name of the Father and of the Son and of the Holy Spirit. Amen. Family member say you they get me live now in 90.9 studios na Freetown, 101.3 na Makeni, 91.7 na Bowen, 90.7 na Kenema. And you same way so can add your voice to the program na 079 900 or 077 315 Don't forget for support the radio in cash or in kind, as the radio depend on divine providence. As I say inside today young program, we look at healthy aging, and we all want for age. We all they pray for that we all. But some challenges they can come. So today we go and look into questions. We go on for look how healthy age go be or age go look on we. So for that I get the person they help me for talk this talk today when a physiotherapist Deborah Kumba Gauja. Deborah, I can tell viewers and listeners out there.
Yeah, good afternoon, listeners and out there. Well, me na Deborah Kumba Gauja. I'm a physiotherapist working at the Sierra Leone China Friendship Hospital, where people normally can say Chinese hospital. Well, today at Denaya, for me we can talk on the theme where we celebrate this year worldwide, when at the World Physiotherapy Day, September 8th, and the theme the day about healthy aging.
The theme there about healthy aging. That's not the voice of Deborah. Keep glued to your radio or your Facebook page for follow this program. I want to tell you one single powerful tool for let you age well, not to tablets, not to pill, not to a miracle drug. Now something way accessible to almost everybody and it completely free. So that make this year physiotherapy they look at healthy aging. Also then talk about that say there is a very important tool we then call movement. So welcome to the show and add your voice to this program. So you were there out there where they view or where they listen, I want to let you raise your hand up if you want for live long or if you want for get long life. If yes, then keep that hand up and say your ears go be filled with energy, independence, and do the things the way you like. Then at the second part, so we dey look at wetin na healthy aging, and that's na the focus for 2025 physiotherapy day. So una let we listen to this program and make we say very very active. So the big question they tell me about how we want for age well. You want for live long, and you want for stay healthy. You want for dey 70 80 but you still strong like the way old 30 40. Not to a pill, not to magic, but the tool na movement. And so they go now to Deborah straight into the conversation for let it tell we wetin e really mean for say healthy aging. Wetin e really mean, especially inside we context today na salon.
Thank you for such a wonderful question. When we talk of healthy aging, I mean say you get for stay active and mobile, you get for maintain relationships, and also continue for do things the way you value as you dey age. That means your physical status, your mental health, your social well-being, and your functional independence. For example, what do we mean by staying active and mobile? One, you get for the do exercise them wey prescribed by a physiotherapist, and also you get for get a good balanced diet, and that will keep you moving. And also when it comes to doing wetin you value as you dey age, like for example, you value for wash for yourself, for eat for yourself, you value for waka go out for yourself, you value for dress yourself, for brush your teeth. All dem thing na thing dem wey you wan for dey continue for do as you dey age. Then in maintaining relationships, it means that you want for dey na community, you want for be useful na community, you want for go na church programs dem, family programs dem, you also want for dey go na workplace, interact with people dem. But if you cannot move, you cannot do that. And if you not keep moving, you not keep for exercise, eat a good diet, then it will become very difficult for you for engage in dem thing there so as you dey age.
E go very difficult as you dey age if you no maintain dem thing there yaso. So remember say you for be proactive, wey na a shift from not just being sick, but na for let you optimize your function and well-being throughout your life. And when we say healthy living, e dey beyond absence of disease, and e also dey talk about you independent. So for say healthy aging, that's not the theme for this year 2025, where the answer you go see and say is simple as you dey think, but you need for start for understand the role of this physiotherapy and healthy life. And it don also rub more span physical, it don rub more span with mental health, and even with social well-being. Don talk about relationships, and you don talk about we staying active. So it's not about adding years to your life, but adding life to your years. So now Deborah na physiotherapist. We want for know wetin na physiotherapy, and same way so wetin na the role of physiotherapy for promote longevity and independence.
Okay, thank you again, Madam Gifty. When we talk about physiotherapy, physiotherapy again na unique healthcare profession wey dey part of the well body team. You know, we dey deal with humans dem wey don lost function either as a result of illness, injury or deformity, so we can get dem people back to function, even if not 100%, but to that maximum wey be say e go be useful na the society. So when we come to the role of a physiotherapy na in longevity and healthy aging. One, physiotherapy dey there for improve your muscle strength, because for make you able for waka, you get a very good muscles, your muscle get for be good for make you able for waka, and also you've bone them for strong, you know. So we dey improve again flexibility na the joints dem, because if the joints dem stiff, you go find am very difficult for waka. So we dey in there for improve flexibility na the joint, and also stability. You know, for make you get if you get a weak muscles, your joints and tight, trust me, you're not able to get much stamina. So we as a physiotherapist, we can come in for help you for improve your balance, your function and stability. Because if you not get enough muscle strength, the joints them stiff, you not get stability, then you will find them very difficult for waka. So that's why we the physiotherapists and we can step in for improve function for people them.
Like you step in for improved function for people then. And many of we they think of physiotherapy as something where you need after a car accident or surgery. But what if not so that's not the case? As you don't hear it, then they for help, for get flexibility, for get stability, for improve your muscle strength and all of them one a day. So physiotherapy not to something no more where you need because you don't get problem, because you don't get accident, we need so and so and so. So important and a very important job. And they actually stop then things then for make them happen in the first place. The physiotherapists not there until problem be. It there for let you even go, just as I talked last week. You need to wait till problem come. You need for the go na garage for make them do maintenance. You need wait till the tire burst, you need wait till the oil done, you know the wait till the water done at the motor car. You dey go for regular maintenance, so you go able for make the motor car stay long. So same way, so we na motorman, we self need for the go na clinic, not to until problem arise before you see the physiotherapist. You don't old or you don't carry age or you don't experience some stiffness and all of this, then they for you for ensure say you get flexibility, for ensure say you get stability, for ensure say your movement is okay and you able for go from one place to the other without somebody in support. E also don tell you say not to a pill but na a tool wey movement na key. So we need for work for there we help for prevent anything wey go affect we bone and affect we balance. Now we get evidence-based benefit of movement wey dem go say movement na medicine. Just last week I say when you keep fit na medicine, when you exercise na medicine, when you eat for be satisfied and not to be stuffed na medicine, and all and dey promote longevity. Today we still continue for the talk about healthy aging wey physiotherapist dey say na key than the tomato man. So now we wan look at movement as medicine. Movement as medicine. One place sit down, no to medicine, but when you pass na medicine. Na so the one day we do this study steady. So Deborah.
Yes, ma'am. Thank you, Madam Gifty. We get a lot of evidence-based benefits when it comes to movement, and we physiotherapists we always believe that movements are the most powerful medicine. You can take all the best pills or all the medicine in the world, you can go through the best surgery in the world, but if you cannot move, then it's not worth. So I want to say there are a lot of benefits them and evidence-based benefits them. One, as movement as medicine, it improve your cardiovascular health. That means say it prevent you from making you not get some heart problems them. Like for example, if you move, you exercise, that they help for reduce your cholesterol level. Them also it help for reduce fats na the heart. You know, some of them think they way too much fat don't accumulate na the heart, it lead to some serious heart disease them. Them also, if you not somebody will get high blood pressure, with movement it able for reduce your blood pressure. Yeah. Then movement also they increase blood flow to the brain, because to make you stay active, let your cognitive be good, let your brain be sound, then you therefore involve in exercise them or movement. And when you do them exercise they also it send enough blood supply to the brain, because them brain cells then they feed from this rich blood, this oxygenated blood. Now they themselves they feed. So if you know they move too much, so enough blood flow no they go to the brain, and you know they expect the brain for work as we want to work. So it improve also in that area there. The movements also they prevent you from other these health conditions like osteoporosis, where you bone mass it reduce, your bone not too strong, you know. So with movement, regular exercises, it prevent you from that, because if you bone not too strong, maybe small jam or small twist the bone they broke, you know. But if you engage in movement, it prevent you from the entire. And also it prevent you also from sickness like arthritis, you know. One side sit down all day, the joints they know they move, you know. So extra day they wait for move, where the body for take away, where no need, they accumulate, it cause some of them joint problems they are, so where they make it very difficult for you for move. So with movement it limit you from them, it will prevent you from their sickness they are, so yeah. So when it comes to the psychological aspects also, like I say, movement it get a lot for play towards the brain. So now some of the evidence-based benefits and then when it comes to movement.
Family, they get to live from Radio Maria Salon, the Christian voice. Now you all send this now where body talk, where they come to you 4 to 5. With me today I get Deborah Kumba Gauja, we na physiotherapist na the Chinese Friendship Hospital, what we can call Jue Hospital. They look at the World Physiotherapy Day. We talk this year about healthy aging, and we don't see say movement na medicine. We all know say exercise good for we, but when science talk about movement for saying a medicine, waiting that prescription they really they do now that it don't explain by how it will prevent the bone for soft. It don't prevent inflammations and some other problem there, even heart problem. It dey help for prevent them one and day. And also we consider am for be a physical pill, as e don say, because for the bone and the muscle and dey strengthen we heart, e dey help follow manage we weight. Also na a safety pill because e most effective for improve balance and prevent falls. And same way so na a mental health pill because when you move, e dey help for boost your mood, e dey reduce you for let you not be anxious. E also dey improve for let you sleep well, and dey protect the brain for then same the way most people as dem dey age dem dey begin for dey forget. So remember say movement na medicine, and as na medicine e get plenty benefits wey e dey give we as evidence don tell we. But amidst all of this, yet we still get barriers, yet we get challenges dem wey go make some people not think say movement na medicine because of one reason or the other. Possibly the points that wey Deborah don raise, maybe some of them don already get some of them conditions there, but we want for see how for overcome them barriers here for staying active.
Yeah. Okay, thank you again. We get a lot of barriers them, you know, where they limit we, yeah. One, we get when you do suffer from chronic conditions and health condition again can be a barrier for make you not able for move. Like for example, somebody they suffer from arthritis when a joint pain. If always have somebody that you want grab for work, they feel in joints there in body, all the acts, trust me, you know get the energy for go begin exercise or for move, you know get the motivation. You go talk say me if I grab for go exercise so I go feel me joint and me body all of for that grab self in the morning me, you know. Some the way can get condition having to do with low back pain. If they take and say me where I sit down for long, or if I run for long, or say if I want butu for take something, in the morning me I dey feel this me with bone and so by then thing they are so this person no go able for involve in exercise. So that is self na other barrier wey go limit you for make you know exercise, yeah. Then the other thing also na when it comes to the psychological aspects also, trust me, if you so depressed, you get a lot going on in your mind, you know they think of for go exercise or for go involve yourself in any activity. You go just wander dey one side, think on meditate, or you know allow yourself the situation get over you. You no go even get that energy. Then sometimes again they look at yourself, you say, hey, look at me age, na me they can go begin jog, na me they go exercise, and na for them picking them now where they come up, now they get for na they need for do that day. So you don't already condemn yourself, you don't already, you know, you don't take and say yourself not fit, you know, you don't pass that stage day, but you need them as you the age. You need them, you know. Then we get environmental factors them also, which can be a barrier. Like for example, the weather. You know, sometimes you want to do outdoor exercise, you want to do a workout, you want to go jog, or you want to do brisk walking. Then the weather not favorable, so that is a barrier for make you able for move. You know, then also maybe the environment where you dey na a rocky environment, you know, get footpath for waka, all of them stuff. Then or you dey near the sea, you know, some of them side and they, you go find it very difficult for it make you do outdoor exercises. Then also sometimes with status also. Somebody they take and say, me in a big man with this title what I get with this and all, for go begin exercise or for go begin do this, do that. They take and say in status not go permit them for do that. All that need a barrier. Then also the type of works them when we engage in, especially some of we then housewives them. In the morning you get for grab, take care you picking them from there where the picking them don't go school, or you man don't go work, you get for do house chores them. From there you go na market, you can't cook, the picking them come on school, you get for take. So time no go day. You know they get that time there, or even you the husband in the morning you don't go hustle for can support your family. You go there all day till they can, you don't tire. So all the things then are barriers them way they affect we. Yeah. So now some of the barriers them done.
So these are some of the barriers them. We don't know say movements na a tool where they help we for be healthy. But why it can be very difficult for we partake in that one day. Of course, the biggest barrier, not a physical barrier. Now, often the story what they tell we say are too old, are too busy, as Deborah don't say, or it don't late, or are too weak. or so their own job, as they don dey tell you, physiotherapist their own job na for help una for rewrite that story wey make you say you too busy, you too old, time no dey, me work. But remember say you work na wey you well na im make you dey work. If you no well, you no dey work. So in as much as you get different job wey you dey do, or job wey confine you to one place, whether na driver, whether na stenographer, or whatever wey dey keep you for sit down too long, or you get lesser movement, know say e very important for make e improve your mood and all of the one dem dey. As e don say we get fear, at times some people already get fear, so it can be challenge for. We get lack of motivation. Some people want wey dey exercise, leg get other dey motivate am. They don talk for some of all the other things here, but we for try for refrain from the one and dey. You can need for schedule your own time. You can need for friend them time they are play with you, pikin them and grandpikin them and all, and also for the one they will get them conditions they were very challenging to them. The physiotherapist na the expert wey go able for guide you for do wetin will help you for may you continue for be healthy. And also don't talk about statuses. Most of the time, most of we don't take with status than we health. Remember say your health matters. And as I say, now where you well, you dey work. Now where you dey well, now in the office will cherish you. But if something do you today, bet you the office go still elect that person, or they do all the work well, but then still go assign that person in your place for less than as proxy. So you health come first, look after your body one, and do waiting right for go na garage and may they do maintenance. You need for go na garage for do maintenance. As I say yes, last week we get the decades, we get your own challenge. From 20 to 30, you get 30 to 40, and 40 to 50, then ages there, so they all get in challenges. You get challenges as you dey 30, 40, 40, 50 with diabetes, hypertension, and all of this as you dey age. You just think say you get for sit down one place, the type of food they eat, the young one themselves exposed to them, you then possibly go say they're active because of football and all of them, and go say go do health talk, go hiking and all of that. But as you don't the age, they fight towards retirement age and old age. It can be challenging. Very few now go take the challenge for go church or do them walk and all of them, and even they go down and come up in step where go able for help the muscles for be strong, the muscles them for be flexible, and all them benefits there where Deborah don't say. But amidst all of them challenges there are times where can surround. Amidst the times where people still for go na hospital, yet they not go until problem happen before them find the physiotherapist in Domot. Just as I can say, at times most people until the eye don't well or it don't go far before ever it go see eye doctor. Likewise with teeth safe, we not they go check until the teeth begin hurt, and at that time you know say you get 4 5 when we get problems. So it's the same with our movement. So now amidst all of this, yet in the years of practice, you must don't get success stories there. We are impossibly that we don't consider themselves, I'm too old, I'm too tired, and for older again this age here, I'll be no more, and I go, they go so no more now. You have had people who don't tell themselves such words, whereas you have had those who have challenged themselves. Whereas you get others wey get either or them feelings there, but una don't use una master sabi way for talk to them and change things over. So are there success stories that you would want to share?
Yeah, thank you. We get a lot of successful stories then. A lot and a lot. You know, we get patients them we don't suffer from different conditions, and like low back pain to an extent, you know, be the worker again. They don't take and say they're not useful again, you know. They're not able to do anything again for yourself. But at the end of the day, when they carry them at the department, through intervention, encouragement, because for make you able to gain some of them success there, it takes a lot of patience and education. You know, you get for educate the patient, talk to them, encourage them, because they cannot lose all the hope where they get. You know, and also the families them around they also can don't get tired every day for move and go and do this, and then self get their own thing the way they get for cater for, they get for go out there and do something better for themselves. So it can be very challenging, but for we that's what can be a challenging something, because now we work. so we can encourage you. We don't get a lot of success stories and when it comes to low back pain or arthritis patients them, even stroke patients them. Somehow we don't get a stroke attack before one side don't paralyze or one side don't weak, you able to do nothing again. They can say that's the end of a life. But when it comes to the physiotherapy unit, we able for help them patient and they come back to them become useful in our society. You know, we get a lot of successful stories them, but it all depends on the time when una come with the patients them now we unit, because when you delay with them back it dey cause more problems. So the earlier una get some of them cases then they una bring them and we self go intervene early so that that patient will get in function way in need. Yeah, so na that.
So that patient go get in function wey e need. You rub mud pan. I think this na one common thing wey possibly maybe we go take 1 or 2 minutes for me you rub mud small pan. We see say ages cut across mostly can get low back pain, possibly because of the way they carry load or way they lift weight and all. I don't know if you can throw lights on that, because possibly sometimes some of them tell what they do at their younger age now and they begin pile out to their old age and all. The manner as how we they do some things where maybe you can able for work more on small, where maybe most of we guilty, where that can be an opportunity for law change. In as much as there have been success stories in line with some of these cases coming, waiting now some of the advices they won't be done they give them, or waiting at their stories where they say lead them to maybe such. It might be maybe their lifestyle or maybe because of age or some other things we make some of them come with low back pain, we end up for the success story. We come with arthritis, we end up for the success story. We come with stroke. Yes, we know say most people then get now don't they get, even young people now don't they get high blood pressure where they don't even know. And we always say high blood pressure now a silent killer. And some people can come so hard on them that the first time ever can just lead straight to stroke. So, and these there will be some success stories. We actually don't see some stroke victims there. Or if people say wow, so this thing it help them, look at it they work now, look at it they do so now, look at it this. So those really are success stories. So possibly with these stories sharing them can able for uplift somebody there or a relative there we don't think say no more all is not well.
Yeah, thank you so much. I would like for throw light on, of course, when it comes to the aging, it's normal as with the age, degeneration will take place, you know, a lot of degeneration will take place. They'll reduce in certain things as with the age. But nevertheless, when we young so, we lifestyles them count a lot at an early age. We dey smoke, we dey drink excessively, you know, we dey do hard work then every day we get for bend down butu for ace, especially then we brothers the way they into the hard labor get for go ace block to go do this, go do that. Even the housewives them work the way we can engage in for butu, for sweep, for brook, for club, all them things, and they change the posture of the spine and it gets a negative effect on we as we dey age. Yeah, so also we dey encourage people them for they check them blood pressure, because now one of the things then they where most of the cases them what they get when someone can don't get this stroke attack, it go tell you say I not be ever no say I get blood pressure pass, so this thing don't happen so to me. Could they do you regular checkup? Let you know if you're not hypertensive patient, if it's needful for you start the drug, then you begin start for take you hypertensive drugs and begin for eat a good food or balanced diet. Like for example, then one day you eat too much of salt, too much of maggi, too much of fatty foods, them all the one they not good, it they lead to hypertension. You know, the one the way they drink excessively, all them lifestyles and they get a negative impact even before we be the worker. Let me if you watch now the rate of stroke or other conditions there, it don't increase so much due to the lifestyle. Before we dey waka 1-2 miles them for go, but now we no dey gree again for waka. As you dey comot na your house, you dey chin up na the domot, you don't break bike, you don't take bike go. Sometimes when they can walk from inside motor car to your office, from your office to your house, even you have your office and for you can wait you sit on one side, it dey pass 8 hours you dey before computer. they grab self or do some stretching. At least when you don sit down after 1-2 hours, you grab do some stretching, move around, you sit down back. But then prolong sit down there also, even then prolong standing there also, all get a negative impact on we. So we get for put all anything and then into consideration. If you're an office worker, when you don dey na office, you don sit down for long, grab small, move around, do some 1-2 stretching there, you sit down back. If you dey every day you motor car wey share time motor car, you can office, sometimes just pack a long distance, take that walk, can your office, work at that long distance. But now all of them things they don change, and dem don make now a lot of dem conditions there we dey find we self involved into them. And by the time now they know say, oh, for don dey do this, or for don dey do this, then it's too late. So na that.
Then it's too late by the time we dey know. So the key words them we Deborah say na that as we dey age, degeneration dey take place, meaning wetin dem be don dey naturally because of age, himself get for reduce. So also wetin we don dey do in we early age dey tell on we in we future. I can say normally woman dem, you wey dey watch na Facebook, you say normally when you wear shoe, at least na so we foot for day, but we mostly don dey in shoe when na so e dey. So you find out say if you foot dey down, so the heel always strain for 8 hours times 5, when na 40 hours every week, 40 hours every week. So imagine the kind problem wey e dey cause to the spine. So even with lifestyle can be challenging. Wetin we dey put on the woman dem, so woman go wear high heel wey dey na office, stay off in a pull am. Whereas say wey dey na office, you need for the move up and about. What I know you for say you dey dress, you dey dress, and go wear high heel also, you dey comot up heel cardon where you can at a level ground, you can dress to that way dey. So your health matters. What if your foot broke? Now you get for suffer, you go feel the pain. Then also still lifestyle changes in line with smoking, in line with drinking too much, and also this regular checkup. I think say that day dey now with vocabulary in a salon until things worse. You go see dey hearty, then begin say you get 1,000 reasons for it. Just say me just salad with medicine, but you don't say this Panadol 1 time 2 times still you ate not the cool. You not say for probe more, you for go out and search more. Just walk into any pharmacy and go med and check your blood pressure. At least 1 time per week, you will not know say you get pressure. May you dey check up and get a small book for it and record. So if the pressure na low, they go tell you. If e high, they go tell you. If e normal, they go tell you, and they go tell you some signs. But one key thing will still say hypertension na a silent killer. You can dey waka, you get the pressure, you don't know. Last week we do medical checks for some people them. Somebody be there wey in pressure be so high, e dey 170 over 110. We check am over 2-3 times, it is still high. He say no ever know say in get pressure. So imagine that kind of pressure. Whereas if na some other people maybe just a pressure like that, then go get stroke straight. Whereas others, God make everybody different. That person go waka, they go. Therefore tell am say go rest. But if we go tell that person say go rest, he still not go rest. Maybe he go there now, say no come on, but he get for concentrate na phone there. So you have all of these lifestyle. So amid all of these success stories, amid all of these with lifestyle, we all the lifts. They can tell you say the way they go tell you for go down for lift something from the floor, you don't go bend. You where they cook nowadays, some gas don't can wait. The woman go just stand up, prepare everything, doing work other than they bend, go make fire. Go take part of the boot clothes and all of them thing there. So all of them thing there. Some of them don't use for the go na in garden, not able for go now because of age, but where it begin change small. And one thing remember say, if you don't go through these challenges here, now you want for come over again, not be automatic. Do a normal over and over, you go back, you go overuse the muscle again. I think say Deborah will talk on that one day again. You think say now one go, till we don't do 10-20 years ago, when and I they tell on you can't just solve it in 1 or 2 weeks. So if it costs you, say you get for the go clinic every week or every time, the timetable then give, I think that's another challenge. We are in some time where then give people then compliance and adherence. Some people not they obey. Now when he feels say if I go, now they go. So this regular checkup. So una don't ever in una success story, una don't ever get somebody we just go see una no more say no because of age no more. I can just for do some exercise or until they go with problem.
Now one since me begin practice, I don't get one single patient we don't do that day.
And then suppose for.
They're supposed to dey do am.
So fambul una suppose for dey do am. You suppose for. The time when they go na gym, the time when they go na ya. Then sef na dem own gym than dey then na master sabi people dem go tell you wetin for do. For you age or you kind condition, whose kind exercise wey you for do. And you no just go no more than tell say can ace that iron, can ace this or make this iron, let ace your foot no. Then get all them screening them way then go do. But I believe say towards the end of it go take you through the checklist, wetin involve for somebody wey wan go enroll. Even though you know for them, you know this, but you know say because of age, you want still maintain stability, you want still maintain flexibility. Wetin you for do for me, you able for match up. Remember say what they talk about success, we not only they look at stronger muscles, but they look at the joy wey you dey regain. So if you be the work now you got in, we dey expect for let you go there back. If you dey do certain things, we dey expect for let you do am back by how you take the advice from the master sabi people waiting they tell you. Now you feel inspired by this, so now we dey challenge you wetin na one thing where you as listener or you as viewer at this present moment you think say you go implement after this we 1 hour ya. Would you decide for the work at 10-15 minutes for day, you decide for stay active, you decide for the do muscle exercise, not so one go you get for pull all the train, or you say na every week you dey go play football where at the end of the day the that football where you go play you muscle then get for add for the one next 2 weeks. Them get mild at things where them go begin tell you for begin do first before you go into something way very heavy and very painful. Just like you go then go talk about workout, you want go play ball, then go get some few exercise the way them go do, and go tell you say if na kitchen you dey at least you go you for do more standing than sitting. And even the chair last week I talk about we not for glue to with chairs them it dey become poisonous for we because we dey stay more time on with chairs rather than we dey move up and about. And then the general rule na that move more, sit less. So when you move more, you sit less, it dey able for help you. Normally in the communities, I know say possibly it might be business where people want go into business, they get gym, they get this, they get that, and all of them one day. But mostly in the communities, we can say maybe when you do something new and you go feel tired, you go feel burdensome, especially for the young one, they go see it and say, no, next week Saturday we get health talk, no, next week Saturday we get jogging and all of this. All this now a journey to healthy living and healthy aging where you go along with others. But we need for look at something just as we don't begin talk just now. You may not say most people then 99.9% as salon no get doctor until something happen e go. So some of we no doctor no we history or nurse no dey we know we history. Where you go say if na anything you say hey una call so nurse he know everything but me, or so doctor he know me history. Other countries they get family doctors or they get family nurse, but in Sierra Leone you know it's not about money, but look at those who are committed, those who you know they can give their time. It's about passion. As we can say, all profession you get those who are passionate, all profession you get those when a job then get, you get others where then they do them even though then they pay them, but you see the extra zeal and power where then they give, whereas others are just doing it for their take-home salary. It's not what they love. So as Sierra Leoneans or as family members, you need to get somebody we know you history in case of something. He can able advise, he can able for guide, he can able for tell you say hey una family una get diabetes, una family una get hypertension, una family sickle cell dey, una family asthma dey, so na so and so for do dem go constantly dey remind una or guide una. But 99.9% as I say no get family nurse, neither family doctor, neither family pharmacist before I say na physiotherapist. So maybe even today na some even know say somebody dey wey na physiotherapist wey responsible for help people with muscle business and with movement. Then also you find out say most people na just over the counter me do at let's just go na pharmacy and buy me teach that this me muscle na dey ask me let's just go buy diclofenac gel, let's just go buy Deep-It, but not knowing that maybe something very serious dey go. Just as I said last week, why make man them they avoid the hospital or man them they avoid doctors? Because then they live in that issue of they are brave. because they don't grow up from where they're small, and they tell them say, well, you na boy pikin, why you for cry ba, why you for, so they take and say if something happen, if you talk am, then they consider am for be very weak. So by the time they detect say certain thing don happen, water don pass flower, e don very late. So you find out say men then they get a very very hard consequences than the woman. Because woman for any small thing they talk, but man now will always want for brave am. E like na that pain we go get for kill am. Pass on 10 away can to the worst now, direct na theater. So we get for speak up, you get for find somebody where you confide in na the well body field. So they go able for advise you. And not only for confiding them, because there are times when I get people that will really the advice una, but una not they take. So person, especially the younger folks, they're not they take. Right now we do something where we they able to do free tests for people hepatitis. If by consent you wish say you want to do HIV, malaria, you blood sugar, blood pressure, you wait, you still get young people who say, okay, but I need go there. And you can see that most young people, they move ahead with conditions where they don't even know. We're very challenging. So you go just sit down and say that they just cry here though. So I told you there are more than 1,000 reasons why people they get that. So let we check. We say it's not about your physical appearance. Just like you go see motor the outside good, but possibly no but motor where they buy na the engine they make them check. So you never can tell if your engine functional or not functional, or your engine need water or it need oil. So all of these are important. So we want to look at the pathway when it comes to the community and local services. How it don't they look like from your experience?
From your experience, for now we don't get any community resources, because for do that you get for deal with the community-based rehabilitation, you know. So but wetin dey limit we from that now, because we no get enough trained staffs them, you know, because for involved in them thing that you get forget enough trained staffs them. But now as we dey talk, we don't get the physiotherapy school in the country where they Masanga, and we dey train staffs them, and I'm sure we get for begin do that to time. But for now we not get any community resources. So I will say okay, people they will go yonder, or they will go give this out, or they do this. But again, we get physiotherapy departments in different parts of the country. Like for example, we get the National Rehabilitation Center within Aberdeen New Market. Then we get a physiotherapy service there. Then we get the 34 Military Hospital also. They get a physiotherapy department. We then go render a physiotherapy service. Then we get the Connaught Teaching Hospital also. Then self get a physiotherapy department. Then we get again they say I don't China Friendship Hospital, Simi attached. Then self we can render a physiotherapy service there. Then we get na McKinney, the McKinney Government Hospital also. We get a physiotherapy department in at the government hospital. Then Nakano Government Hospital also we get a physiotherapy department. Then we go to Bo Government Hospital also, we get a physiotherapy department, and Kenema Government Hospital we get a physiotherapy department. So far now then inside the day we dey able for give service, and I mean quality service.
Quality service and way accessible, because now all the regions and physiotherapists them dey. So may you not ask questions where you don't know outside you for go get the answer. And we they also talk to Soriat organizations them where possibly they into rehabilitation for see how they go partner with the physiotherapists them, as soon as you from all the different sides where they for see how this go reach now the doorstep of everybody, because we already don't get some people them way like a very challenging step for them for going at the physio, because they are not mobile and they not get even vehicle or keke or whatever we go able for carry them. But as they say, I think we need human resource, we need training of staff. We get nurses them, we get clinical officers them, different cadres them, where possibly if opportunities there, then go see the need for me then go take that one as a specialty for help for increase the mobility of we people dem na salon. So you wey feel say you get interest in the training of being a physiotherapist, the school dey na Masanga wey na Tonkolili district. And also I sure say if you want to get more information, all dem side wey Deborah don call, you can go there and ask question, so you go know when forms will be out and let you know what could be done. And also to the SOIAT organizations, for una see where they into rehabilitation, for una see how una go partner with them. And family wey get patients or somebody at home where you think say you need a physiotherapist, you're not able, but maybe they can do the arrangement for see by the distance, possibly go na in house for do the physiotherapist and all. It all help with the arrangement we una go do with them. So that. But amidst all of these, Deborah, as sure say still una dey face challenge as department. I know say one of them could be that most people don't even know that we are physiotherapists, and that's not a specialized course in health, and that we get younger people, both male and female, where they dey, and it dey in all the regions here where you don't name. And amidst all of these, yet there are challenges where una departments they face, or the wing of physiotherapy.
Well, even though we get successful cases them, we also get challenges them also. So I want to say we get challenges from the community, from we brothers and sisters wey no dey come with them patients there wey need physiotherapy service. And also one can be because of some they not get the know-how, or someone they say if you know one day you about physio, you don't even know wetin na physio, you know. Some man know, but you know they go there. If they take and say, this way don happen so to this my brother, yeah. Now which gun they don't shoot her with? If they go first country, we go waka, go all inside, and they then tell they can't we, then the thing don't get severe, you know. And some of them people and they don't know the amount of damage, because them, like especially when it comes to stroke, now damage where they come out from the brain. So if they don't know the amount of damage, then they self begin do their own intervention. At the end of the day, they add more problem. So we encourage them for make them come with them patients. Then they now we units now one of the challenges, and then two, the acceptance. The acceptance is very key. Then come with some of them patients and at the unit. Trust me, they know they accept. For me, they accept the situation and or the condition a very difficult, a very tough. They therefore take a lot of patient education, talk to them, encourage them. There are some even when they come, they go tell you say today, you know, I don't need no service, not touch me today, not do, I don't want for do anything. Today I just want think, I want $1 think far. You know, and now we patients and they get right. If you say no one touch her, you touch her. But I think say if we still find ways for convince them, for encourage them, talk to them, make you able for see from who side they come out from, then no say whatever they do for them now for the betterment of in condition. So now one of the other challenge then the other one again, now the families them, they are they talk to now the relatives them where they around them, you know, they're already depressed. Trust me. If somebody blank go work for himself, he blank eat, he blank wash, he blank brush his teeth for himself, he blank perform in daily life activities or in daily routine for himself, then at the end of the day, he no able do any of them things, and they no able move. That one is very frustrating. So sometimes a lot of mood swing can come in, but we just therefore continue for being with them. We get some families them, then they try, but they reach a peak, they can want for like give up. So that is sometimes can be a challenge. Some patients there, we don't tell, we don't see how it come. We say, but what's happened? They go tell you say, now that my sister they count me, say don't tire, or you don't begin go find money, so possibly not there for count with me. Or you go tell you say, you know, for pay, you know, easy. Some man they even can't self, you know, even get medication. If they can now for say you don't can physio, but they can physio in pressure, in blood pressure very high, wey risk itself pass the car where they can. So if you don't get the medication back for take, all that thing it can be challenging for we. Sometimes as we can step in, you know, give some man medicine for dem pressure go down, control im pressure and all of dem thing dem. E no easy. We know say we mama, we papa dem, uncle dem, una kin try a lot, but e no kin really easy, make I no lie to una. So na some of dem few challenges dem we can get, yeah.
Wow, so Fambulem as una don hear that's na challenge, and we also want for change we mindset from fix me to fortify me. We also dey work for this we culture of aging, from one of fear and decline to one of strength and possibility. And you as an individual, you responsible, the family responsible, the community responsible, and the well body workman self responsible. As Deborah say, that will continue for overcome that belief we say me I don tire, or me I not able again, or me na so and so. So we know say it can be challenging. So now that make we dey talk to sorry health organizations dem wey una know say una passion dey for help dem want dem into rehabilitation, for partner with them. And so that is some of the challenges. There are times some of the patients not get their medicines, and they knock out high blood pressure, then make them do physio. And there are times some it can be very challenging for them for even mobility, for make them access if na inside Freetown, for access Connaught, or for access Jewel, or for access 34, or for access Handicap International Aberdeen New Market. Likewise the other side them way the upline. So we want to continue for tell thank you to the parents them, the loved ones we don't they give them support, and the well body workman their way amidst all them challenging moments there. So themselves don't they do them. And all I know say the physiotherapists themselves they go through some mental challenge. I go say mental challenge in a sense, because there are times you wish to do it but you don't have it. So you they make you mood they change, and you they feel some kind out because I get the know how to do it, but I'm tired. I don't get the provision of the equipment or the medicines or what it takes for they are able to support this person. So we dey ask sorry health organizations them for give them support and for come to the aid of them and patients then they, and if all then at the community now we engage the times all they in with different groups them for educate yourself how we important for avoid stress, why important for exercise, why important for they go out for preventive medicines rather than we wait say water pass flower and it be challenging. As you say, there are times they go don't pass to Twitter say na this by the time and then they count you now it done very late. So let we look at that one day again and see say we try for do that, and we try for improve access and reduce. I think it's another one how I miss most people no, but yet I know say there are times more people can go to now. So you already named the areas then about the accessibility. So how about the waiting time? Because there are times maybe some patient no one go say I go there now all day business where like maybe when I can explain to them why I sure I get scheduled days. It's not every day that everybody will be going because I get time when I go for put on a data's in place, when I get for do this or go outreach and all as the case may be. So how una don they work with waiting time?
Well, the physiotherapy department, I can start with we dey work from 8:30 to 5 o'clock, you know, and the area of we patients and where they can come, we can give them that priority. We can see them because like you say we can get alternate days for some patients, and they can come like Monday, Wednesdays, Fridays, some can come Tuesday, Thursday, based on the severity. Like some them will be there in that severe stage, don't they get better, we can put them like twice a week now. You come Tuesday and Thursday. While the one the week in severe, you get some of them that first 10 days or that first 1 week we go say make una come every day. But when they can come for do the assessment, because we can do a holistic assessment for patient them. So it can take time because we get for check your muscle power, we get for check the joints them, we get for check your balance, check your overall, we dey check everything. So that overall assessment it can take a lot because we want to know inside exactly the problem dey and wetin dey cause this problem. Because if you no able to identify the problem, then it go very difficult for you to solve the problem. So you get some relatives wey dem go carry go, they don't say small and of this assessment, this that, it get for take time. Because if we not do again the correct thing at the end of the day back, e dey throw back at we, so we no can want that. So we can take with time, and when they can come for therapy, they can take like 1 to 2 hours na the department, because the reason being each exercise gets in time, and not to one exercise the patient get for can do. E dey comot from one exercise or from one equipment to another. Where you go, you get for get am time first, e blow, so you don do this 15 minutes bike stuff, then until we get am like 1, 2, 3 minutes for the rest before we go to the next exercise. So we got a lot of different prescribed exercise for them. So not so for say as you go so no more na some side wey dey rush for go you comot dey back. We get for take with time. And imagine you get them 2, 3, 4, 5, 6, 7 at the department. How many amounts of patients them? So na some of the ways dem be so we can operate.
So now some of the ways then, and they as to say 1 hour no go do for talk all this talk, but before we go, we not say you not for left this show without you don't get your own plan. So for invest in your movement today, you get for look at waiting e mean for you independent one tomorrow bambai. So you get the power now for shape you golden years where you can begin now. So get your own plan. Maybe you want start say I can sit down too much, lad it in up. Or like go they get break during me time then at office, or maybe you go and say I want now for go begin see me doctor, or la friend nurse, or la go see the physiotherapist, or maybe you want say you go get 5 minutes walk every day, or you decide for do one thing every day. So start for write your story now. So as we can wrap up the program, we remember say we look at World Physiotherapy Day, where the theme for this year 2025 na healthy living, and with me today the physiotherapist so we can for up more pandis na Deborah Kumba Gauja. So Deborah, I can say you tata message and you wish for the community, the people with the listen, viewers, how they're going for support physiotherapy, and message to out to the patients them and who will be patients.
So thank you for that. Well, I want for tell first the Ministry of Health, well for tell them thank you for at least for make rehabilitation go to the peak na this country for they up there, and they see say we dream they come true, because people they don't begin to know about physio. Before people they not get any idea, but now they know say before even when we they get cases them begin awaken then a community we can get cerebral palsy, they see them, some them can get developmental delay, they see say at 6 months if you don't they see or 1 year if you don't waka, some then they go say 1, 2, 3, 4, 5 years they know they waka. You get some then waking can born them with hydrocephalus, they head a big, some then they microcephalus, they head a small. Most of the time we took is we say them picking them and double picking them. So I just want for encourage family them out there say any of them conditions they wait and see, make them bring them. Somebody get overall body pain, low back pain, joint pain, he paralyzed, you know, waka, or whatsoever, as long as now issue we get for deal with movement, you come to we now. Low we see say okay, this not a physio case. But sooner you don't see say your body need a function as how if a function, you need to work again, like I be worker. Wetin they be do before, you need to do again. I want for encourage you now for make una come na the physiotherapy unit, and I want for tell everybody thank you for listening to this program. I want for say I appreciate una all, and I dey look forward for see una na them department and for make we reduce the rate of disability in the country, because that's now we aim. Because when we able to get people then to that function, that maximum function and independence, there we go able for reduce the rate of disability. It can be me, it can be you, by you refine those patients, or by you coming to with departments and by how we serve the render with quality service, then go make we able for reduce disability. So once more, I want for tell una thank you, and thank you once more, Madam Gifty, for this wonderful opportunity.
Thank you very much, Fambulden. That's not the voice of Deborah Kumba Gauja from Chinese Friendship Hospital. Thank you, and the radio open for more invitations for even more other physiotherapists them way go and come and share their experience. So Tete next week left on now in the name of the Father and of the Son and of the Holy Spirit. Amen.